Hello, my name is Clement. Today I would like to share about diabetes and its relations to other health conditions. The dataset consists of detailed medical diagnostic measurements. It has 768 data points of female patients with 8 features and 1 response. It was adapted from the National Institute of Diabetes and Digestive and Kidney Diseases in the USA. After data cleaning and feature selection, our dataset consists of 724 data points, 5 features, and 1 response. Let's begin by talking about diabetes. It is a disease that is described as having high blood glucose levels. In this study, we will classify the patients as either having diabetes or not having diabetes. So from that, we can see that there is 34.4% of female patients in our dataset having diabetes. First, let us find out whether there is a relationship between BMI and diabetes. BMI is simply an estimate of the body fat content of a person, and it is an effective screening tool for potential health hazards. In this study, we will classify BMI levels as such, with levels above 27.5 considered as obese. From this plot, we can observe that as BMI increases, there is a greater proportion of patients that are diabetic. We can also see that there is rarely any patients that are diabetic when they are underweight or normal, while there is an increase in the proportion of diabetes present in overweight and obese patients. We would like to explore if there is any relation between blood pressure and diabetes. Blood pressure is a measure of heart health, and here is the hypertension classification scheme we are using in this study. Similar analysis as before, we observe that as blood pressure level increases, there will be a greater proportion of patients with diabetes. Here we can see from low blood pressure, the proportion of 19% of patients having diabetes to a proportion of 48% of patients having diabetes in high blood pressure stage 2. For women, we would like to understand if pregnancy will affect health in the long term. In the following visualization, we can see that there is a general trend of more diabetic patients as the number of pregnancy or the patient has increases. We would like to answer the question on whether age should be considered as well when we are talking about diabetes. Here we can see the distribution of patient ages over our dataset, followed by the proportion of diabetic patients in our dataset. Although we are unable to conclude any trend for age and diabetes, we can see that for patients aged 31 to 40, about 50% of them are diabetic, and for patients aged 41 to 60, more than 50% of them are diabetic. Takes us to the key takeaways from our presentation. First, we should try to eat healthier, and then we should do more exercise to promote heart health, and we should go for occasional health checkups past the age of 30. With that, we have come to the end of the presentation. Thanks for your attention.